there is this affinity for the oppressed that we have in our society that is something we got to deal with, okay? They're selling merch. Of course, people are going to take advantage. That's what social media is all about. But I'm telling you what the real problem is here, is that despite these people and what they're saying, you do have to look. I don't know that any of them, they're so young, I don't even know what bills they're paying yet, but there is a problem. And I've been transparent. I don't talk about myself that often on the show, but my family is this close to litigation against an insurance company right now for refusing a surgery that, thank God, I can pick it up if I have to. But a surgery for one of my kids that now they're saying they don't have to pay for, we're talking about a lot of money. And that's me. I'm one of the lucky ones. Healthcare companies should be put under the light of exacting scrutiny. They have deserved it for a long time. I'm telling you, this assassination makes it less likely, not more. But I'm saying let's have the right conversation anyway, even though they are right to say right now, you're talking about us. This guy just assassinated us. We need to protect ourselves. These people are crazy. Joining me now to have the right conversation, Lauren Adler, Associate Director of the Center on Health Policy at Brookings Institute, and David McNichols, former CEO at Aetna. Good to have you both. Now, look, on the security side, David, you see everybody putting security teams around them. Have you heard discussion? Look, there's no justifying what the guy did. Is the industry looking at itself at all, or just looking at the external threat right now?
I think the honest answer is it's both. And so, you know, the first and core question to me, Chris, is what did we just witness with Brian Thompson's murder? Is it a one-off by somebody that was disgruntled? Is it a political statement against capitalism and big business? Is it a combination of both, or is it something completely different? I don't think we know all of the facts yet. But here's what we do know, and that is every one of the health insurance companies is facing, since Brian's murder, additional threats, much more vocal and pointed threats. And so every one of the insurers is taking a very deep look at their policies around security. And that involves a whole bunch of things. But no, it's happening everywhere, and they're taking a hard look, and they're making changes to what they do.
Right. The problem is, it's not a problem. They should keep themselves safe. Fine. But Lauren, the problem is they need to apply that scrutiny to the policies that have absolutely been injurious to people they're supposed to be taking care of. Whether you're looking at denials in the process where they're judge and jury, where you're looking at billing, where you're looking at a lack of transparency in pricing and policy that no other industry gets away with, and no other industry has this kind of control over what matters most, which is, of course, our health. What do you see in the state of play within this industry in terms of practices that are essentially poisonous?
Sure. So I think there's sort of two.
Go ahead, Lauren.
Sorry. There's sort of two sides of it, right? I mean, I think there's been just a bubbling frustration with the growing use of utilization management tools, whether that's denying needed care, prior authorizations. And look, obviously some level of utilization management is needed, right? You can't have just sort of willy-nilly costs growing out of control. But fundamentally, in every country has some form of utilization management. But often this really does delay needed care, as your example, gets at, right? There is really needed care here. And also, right, this is adding a lot of hassle costs to patients who are, even in the cases where you get the denial overturned in the end, right? This is trying to get patients to give up, trying to get doctors and hospitals adding a lot of paperwork burden on them, right? There's a survey recently that in individual health insurance plans, 17% of in-network claims are denied initially. Right? That is just a very large number, and most of them aren't even appealed, because most of the times, if it's a small dollar amount, patients may just eat it. Right? Those are right. Insurers do benefit from throwing sand in the gears of this process, and right, there's still faxes being sent back and forth, or requiring doctors' offices to send faxes. Right? That isn't trying to solve this in a quick and timely manner. There's just a real lack of standardization and a real lack of timeliness in some of these processes, even if there is some need for at this at some level.
But David, they do it because they can, right? I mean, other than the ACA forcing pre-existing conditions into the mix, nobody's really messed with this industry. And even Trump, the great disruptor, of all the things that he wants to change about what's putting a burden on the working man and woman, he never mentions you guys.
Yeah. Chris, I think that's fair. The whole conversation around denial and denial management is something that needs much more transparency. There's no doubt about it. But the number that gets thrown around of United denying 32% of claims, there are a lot of reasons why claims get denied. And I've been doing it. I've been in this business for 25 years. And so, sometimes there isn't coverage. Sometimes there are claims for things that aren't covered. Sometimes it's a request for additional information. And in truth, when you get past the first denial, more than 80% of the claims ultimately do get paid. And so the claim of yours that didn't get paid, the surgery, Chris, that's troubling. I'd love to know the details about it and how to fix it. But I think the biggest problem for the industry is it is a very complicated business, and there are a lot of stakeholders.
But they made it complicated. They made it complicated, David. When they do this kind of stuff with cars, you don't think they know what to cover and not cover and for how long when it comes to warranties? They know, and that's frustrating. Yeah. But it's not my kid. It's not my life. It's not the drugs that I need. It's not the procedures that keep me able to live my life. That's what makes this industry different. So even if it's only doing what others do, and I don't even think that's true. I think that you guys have created your own culture of how to increase profitability. It would still be a problem. I just don't know what can be done about it, especially if the industry doesn't feel like policing itself.
Yeah, so it's also the most governed industry in America, and so the regulatory environment is very stringent, and so CMS is all over what we do, and a lot of the work that happens, including that deal with Anthem last week around anesthesia coverage, that was about enforcing CMS policies, not a change in anesthesia, and they just did a really poor job of communicating that whole deal. But I'll tell you, most of the healthcare executives get up every day focused on two things. How do we keep healthcare affordable? And two, how do we improve quality? Because that's how we win new business. They increase profits more from growth than they do from squeezing the dollars.
But David, I'm not looking. Look, we need the industry. Okay, we can talk about how it is and what the fundamental systemic dynamics are and what that yields. That's fine, but it's above my pay grade. But the idea that anybody who's publicly traded doesn't wake up thinking about their shareholders is nonsense. That's what keeps you in the job, and that's what you guys are about. Now, Lauren, give us an end note on what needs to happen next in terms of if you want to focus, if you want to try to distill something that can make any of this worthwhile, never to Thompson's family, never to Thompson's family. What needs to be looked at first and most?
Sure. So, I mean, we've glossed over here, right? The other big issue you raised is the cost of care, and that really isn't. That's not predominantly insurance companies, right? That is the high cost of healthcare goods and services, and primarily we're talking about hospitals, and that's how that is where the U.S. is an outlier to the rest of the world, right? Out-of-pocket costs as a share of total healthcare costs in this country are pretty in line with other developed countries, but it's just the pie is a lot larger in the U.S., so out-of-pocket costs are a lot higher in the U.S., and that's why average household spending like 20% of their income is going towards healthcare spending, and that number is more like 10% in other countries. So I do think that the elephant in the room is still fundamentally the cost of care and hospitals, but I do think there is a lot that can be done to standardize a lot of these prior authorization processes, and I don't think you can count on the industry to police itself. This is where further regulation and telling them exactly how the sort of back and forth between the hospital or doctor and the insurance company needs to go for these denials and prior auths. Fundamentally, that's needed to come from the government.
I did an investigation a million years ago about a charitable hospital and what it means to be a charitable hospital. And it turned out that most of the care that they called charity was unreclaimed debt. That after they chased people and put all kinds of watchdogs on them and ruined their credit rating, they'd write off whatever they didn't get paid back as charity. These are the kinds of things that are maddening to people with something that matters so much. We need the industry, but we need it to be better than it is. Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.